In this video, I will be analyzing the movement of getting out of bed. When volunteering at a physical therapy clinic, physical therapists taught many patients a proper way to get out of bed. I will be doing this along with breaking down the movement into phases, analyzing the muscles working at specific joints, and talking about injuries that may be involved with this movement. Starting from supine position, the first phase of getting out of bed is to flex at the knees. The second phase is to roll on your side, flexing the shoulder farthest away from the edge of the bed. You should then roll your knees to the side of the bed and reach the flexed arm over the side of the bed. The third phase is sitting up. First, allow your feet to tangle off the bed. Push your hand and your elbow into the bed, propping yourself up. Now that you are in a seated position, the fourth phase is standing up out of bed. Use both hands to push off the end of the bed, keeping your spine in neutral position. The first phase is to flex at the hips and knees. Lying in supine, McKenna then flexes at the knees. The active muscles are the biceps femoris, semimembranosus, semitendinosus, and popliteus. The type of contraction is concentric. Hip flexion also occurs in the phase 1. The active muscles are rectus femoris, iliacus, psoas muscle, sartorius, tensor fascia lata, adductor longus. Phase 2 is rolling on your side. Shoulder flexion occurs. The active muscles are the pectoralis major, upper fibers, and the anterior fibers of the deltoid. This type of contraction is concentric. Horizontal abduction also occurs. The active muscles are pectoralis major and the deltoid. And again, this is a concentric contraction. In order to swing her legs over, her right thigh must be adducted and left thigh abducted. For abduction of the left thigh, the active muscles are the gluteus medius, minimus, and the tensor fascia lata. This contraction is concentric. During adduction of the right thigh, adductor longus, magnus, brevis, gracilis, and pectineus are active. This is also a concentric contraction. Now that you are on your side, you are ready for phase 3. In order to sit up, she must extend her knees. The muscles active are the rectus femoris, vastus intermedialis, lateralis, and medius. This is an eccentric contraction. In order to push herself up, elbow extension must occur at her left forearm. The triceps brachii is responsible for this action, and it is isometric. Elbow flexion occurs at the right forearm. The muscles active are the biceps brachii, brachioradialis, and brachialis. This is a concentric contraction. Both right and left elbows now need to extend. The muscles active are the triceps brachii. This is a concentric contraction. Wrist flexion also occurs. The muscles active are the flexor carpi ulnaris radialis and flexor digitorum superficialis. This is a concentric. We now move on to phase 4, standing up. Five actions occur during phase 4. Plantar flexion, knee extension, hip extension, shoulder extension, and wrist flexion. During plantar flexion, the gastrocnemius, soleus, tibialis posterior, flexor digitorum longus, flexor hallucis longus, and peroneus longus are active. These are concentrically contracted. During knee extension, the rectus femoris, vastus intermedius, vastus lateralis, and vastus medius are concentrically contracted. During hip extension, the gluteus maximus, biceps femoris, semimembranosus, and semitendinosus are active, concentrically. Now that we've talked about plantar flexion, knee extension, and hip extension, let's go over shoulder extension and wrist flexion. As you can see in the picture, McKenna's shoulders are extended. The muscles responsible are triceps brachii and latissimus dorsi. This is a concentric contraction. Her wrists begin to flex. The flexor carpi radialis, ulnaris, and flexor digitorum superficialis concentrically contract. Now that we have broken down the movement of getting out of bed into 3 phases and looked at each joint of the body, the ankle, the knee, the hip, the shoulder, the elbow, and the wrist, we'll talk about the potential injuries or the possible limitations of this movement. In this video, you watch the proper way to get out of bed. This usually will limit back pain and help an elderly person get out of bed more comfortably, along with someone who has had post-surgery. So usually, the injuries that have previously happened can be helped through this way of getting out of bed. There aren't really any injuries that result from this movement. However, if someone has a previous injury, it can help them get out of bed by decreasing their chance of getting injured again. For instance, someone with low back pain who usually experiences pain when they flex or rotate will now not have that pain because they're properly getting out of bed. Those who are physically limited, like ones that have low back pain or have had surgery and are recovering, may need help getting up or may have a harder time. Also, an individual with arthritis may experience pain when trying to push off during phase 3. In an article I read by a Harvard Health publication, it stated those who have had surgery need to get up out of bed more often than they think in order to keep moving and keeping mobile. In doing that, this movement pattern is the best possible way to get up out of bed. An individual that is severely overweight may also have a difficult time getting up out of bed as they bear a lot of weight on that one wrist, possibly causing injury. However, if done properly, the weight is both on the wrist and the opposite elbow, helping them move up. My references for this video came from NASM's Essentials of Corrective Exercise Training and Clinical Kinesiology books. Also from an article titled Getting Out of Bed After Surgery, the U.S. National Library of Medicine, along with an article from Harvard Health publication, With Back Pain, Getting Out of Bed Can Help.